Have you ever wondered what happens when the normal tissue lining of the lower esophagus gets replaced by a different type of tissue? This is a condition known as Barrett's esophagus, a topic that is not only intriguing but also essential to understand, especially for those dealing with chronic gastroesophageal reflux disease, or GERD. Barrett's esophagus is a fascinating yet complex condition. It's a situation where the squamous epithelium, the healthy lining of the esophagus, is replaced by columnar epithelium, a tissue type more commonly found in the intestines. This change is believed to occur in response to chronic exposure to stomach acid, typically due to GERD. The peculiar aspect of Barrett's esophagus is that the condition itself does not cause symptoms. It often comes to light during an endoscopy, a procedure where a flexible tube with a camera is inserted into the esophagus to examine its lining. Individuals with chronic GERD are more likely to be diagnosed with this condition. One of the reasons healthcare professionals take Barrett's esophagus seriously is because the change in tissue type is considered a premalignant condition. This means it increases the risk of developing esophageal adenocarcinoma, a type of cancer. When it comes to managing Barrett's esophagus, the focus is primarily on managing GERD and preventing complications. This could mean making lifestyle changes, taking medications to reduce acid production, or in some cases, resorting to surgical interventions. Regular monitoring through endoscopy becomes a crucial part of the management plan to detect any potential progression towards esophageal cancer. To recap, Barrett's esophagus is a condition where the normal tissue lining of the lower esophagus gets replaced by a different type of tissue. This change is usually a response to chronic exposure to stomach acid, often due to GERD. The condition itself does not cause symptoms and is often diagnosed during an endoscopy. Barrett's esophagus increases the risk of developing esophageal adenocarcinoma, making its management and monitoring essential. Understanding Barrett's esophagus underscores the importance of effective GERD management and regular surveillance. If you have concerns about Barrett's esophagus or related conditions, it's a good idea to consult with a healthcare professional for personalized advice and management. Remember, knowledge is power, and being informed about conditions like Barrett's esophagus is the first step towards better health.